Hey there, it's Wayfair here, where delivery and setup are as easy as a few taps on your phone. You're relaxing in an old hammock, scrolling Wayfair's app, when you spot it, a brand new patio set. Next thing you know, Wayfair delivers it right to your patio and sets it up. Oh, you need a new grill too? All right, Wayfair's got you covered. With Wayfair's Room of Choice delivery and fast expert setup on qualifying orders, life gets a little easier. Visit wayfair.com or the Wayfair app.
Wayfair, every style, every home.
Hi, this is Dr. Stephanie Wautier, and I'm the host of Conversations with a Chiropractor. I believe healing often begins with connection, and that's really what this podcast is about. These are real conversations about health, healing, life, and the stories that shape us. Some guests come from the wellness world, some come from the community, and some simply bring a life experience worth sharing. My hope is that each conversation invites you to listen, learn, reflect, and maybe see your own life or healing in a new way. Sit back, grab a cup of coffee, and enjoy this conversation with a chiropractor. Dr. Francisco Contreras is one of the world's most respected voices in integrative oncology, a physician whose life story is as remarkable as the outcome he delivers. Born in Mexico, he pursued his medical education in Austria, where he mastered German in order to understand the lectures and complete one of Europe's most rigorous medical programs. That early determination shaped a career defined by discipline, innovation, and a relentless commitment to patient survival. Today, Dr. Contreras serves as president and medical director of the internationally renowned Oasis of Hope Hospital, founded by his father more than 60 years ago. Under his leadership, Oasis of Hope has become a global destination for medical tourism, attracting cancer patients from more than 55 countries seeking advanced, compassionate, whole-person care. His team of physicians, nutritionists, researchers, and integrative specialists delivers a level of support rarely found in conventional systems. From private chauffeur service and garden-grown organic meals to individualized dietary plans and comprehensive metabolic, nutritional, and immunological therapies. At the heart of Dr. Contreras' philosophy is the belief that healing must address both the body and the spirit. Oasis of Hope's integrative model blends evidence-based medical treatments with emotional, nutritional, and spiritual support, recognizing that patients do not fight cancer with biology alone. They fight with hope, resilience, and the full strength of their inner life. This holistic approach is not only distinctive, it is effective. The hospital reports 3 times the survival rate of standard American hospitals for comparable cancer cases. World-renowned, multilingual, and internationally published, Dr. Contreras has spent more than 4 decades helping patients reclaim hope and extend life through integrative oncology that honors the whole person. His work continues to draw global attention from patients, researchers, and media seeking clarity, compassion, and real-world results. Dr. Francisco Contreras is also a prolific author whose work has shaped the global conversation around integrative oncology. His books blend medical science, nutritional strategy, and spiritual resilience, reflecting his belief that healing must address the whole person. His public works include The Hope of Living Cancer-Free, a foundational guide that empowers patients with evidence-based integrative strategies and the mindset needed to fight cancer with strength and clarity, just to name a few. Let me introduce to you Dr. Francisco Contreras, founder of the Oasis of Hope. Today on Conversations with a Chiropractor, I am so honored to be joined by Dr. Francisco Contreras of the Oasis of Hope Center in Tijuana, Mexico. Dr. Contreras, thank you so much for being with us tonight.
Thank you, Stephanie. It's an honor and a pleasure.
So your father was the one who founded Oasis of Hope 60 years ago. And for those who don't know what it is, Will you give our listeners a little bit of a description?
Yes, my father was a very renowned and orthodox oncologist in the field. And he just felt that the reason for the failure was not so much technical, but philosophical. He noticed that doctors were just taking care of the physical needs of the patients and were being abandoned as far as their emotional and spiritual needs. And so my father felt that that was an area that needed to be taken care of. And so he started looking out for the emotional and spiritual needs and providing them with resources in these areas. And he was not only not applauded, but he was actually kicked out. This was in Mexico City, in the largest oncological center in the military hospital in Mexico City. And he was exiled virtually to Tijuana in the 50s. I don't know if you've ever heard of what Tijuana was famous for in those years, but Tijuana was famous as the capital abortion center of the world. And that was because in San Diego, before Pearl Harbor, the Navy was concentrated in the port of San Diego. And so there were thousands and thousands of young sailors that would get girls pregnant and they would bring them to Tijuana to have abortion. And so my father began his work alone in seeing cancer patients and providing them with the word of God, and so that they would be spiritually strong, so that they would be emotionally strong. This was in the late 50s, and in 1963, a lady from San Diego, California, participated in a clinical trial for a natural drug against cancer. She was diagnosed with carcinoma of the breast in a very advanced stage, went to Canada to participate in this trial with Laetral. And when she came back, she brought Laetral with her. And so nobody in San Diego wanted to give it to her because it was not FDA approved. My father did his training as an oncologist in Harvard, and a friend of his and a colleague was an oncologist in San Diego and told this lady, listen, I'm not going to give it to you, but I know of an oncologist in Tijuana who might be able to give it to you. And so he sent this lady to my dad. My dad saw her and said, there's really not too much hope for this lady. I don't care if it's approved or not. I'm going to give it to her. She has nothing to lose. And lo and behold, she started just getting better and better and better. And she started calling everybody on the trial, and they started coming to see my father. So my father had already started the holistic approach, treating body, mind, and spirit. Then this alternative option was open to my father, and that's what started the Oasis of Hope in
Wow.
Mexico. This combination of a holistic approach together with alternatives. And so we've been helping people since then, over 120,000 people over all of these years from about 60 different countries.
Wow.
In a nutshell, that's the history of the Oasis.
It's amazing. If we have time, I want to talk about how you became a physician. For our listeners, the Oasis of Hope just has such astounding statistics. Like, you are doing better there, treating cancers like pancreatic cancer, esophageal cancer, lung and bronchial cancer, melanoma. Like, the statistics for pancreatic cancer, as an example, 25% versus 2%. You have probably really in the past 60 years come so full circle with your own techniques and your own treatments. Is that correct?
That is correct. Well, since the time of my father, when I went to do my oncological training, surgical oncology in Vienna, Austria, when I came back and started working with my dad, we've always looked how to improve our results. For instance, in cancer of the pancreas, well, 75% do not obtain good results, even though our 25% is 20 times better, 10 times better than with conventional therapy. We're always looking to improve our percentages. And so we've added a number of possibilities or treatment possibilities for our patients within the natural and the conventional. So we're an integrative oncological center. When we feel that that conventional therapy can help our patients, we are going to offer it. And when we know that it will not, well, then we'll offer just the alternatives. And in many cases, is a combination of both. So we have everything available to our patients. But for instance, the usage of very high dosages of vitamin C as chemotherapy, all of these studies were published in American journals, and it was developed in the NCI, the National Cancer Institute, for instance. And so we have a protocol with high dose vitamin C. It was never approved in the States because the studies were never done. Why? Well, there are no patents for natural therapies. So there is no conspiracy against natural therapies, but there's no incentive. And you have to spend about $1 billion nowadays to do all of the studies for the FDA to approve or disprove your drugs. And since there is no patent, then if you get it approved, the next day anybody can do it and don't have to spend a penny. And the people that spend the money would never make the money back because there are no patents. So that's the reason why alternatives have not progressed, not because they're not good, but because there's no incentive for anybody to look for natural things. Well, we don't care about that, and we go for the natural. The other thing that has improved our statistics tremendously is the immunotherapy. Immunotherapy was neglected by the conventional oncology for more than a century. And so we have been doing immunotherapy for many, many years. Well, actually, since the beginning, everybody knows that a positive person, but especially a positive patient, has better outcomes. Why? Because when you are positive, your immune system is going to be improved. And so we do many things to improve the quality and quantity of our patient's immune system so that they will do better. But in the late days, a number of publications came about the use of the dendritic cell vaccine. And this was developed at the Rockefeller University in New York by a number of researchers who, by the way, obtained a Nobel Prize for their development of the dendritic cell vaccine in 2011. And yet
Wow.
in America, it's still going through the process of the FDA. It has not been approved. And we've been using it now for almost 15 years in Mexico. So
Wow.
many of the things that we are doing were developed in Europe and America, and patients have to come to Mexico to get the benefit of them. And because we are open to these things and able to do them here in Mexico, our results are so much better. So in a nutshell, that's what the Oasis of Hope is.
So it sounds like to me that a lot of the techniques and the modalities that you're using are actually very scientifically based. They're studied. It doesn't sound like they're experimental. It's just that, like you mentioned, if there is a drug that can't get patented and it's $1 billion for that FDA approval, it sounds like you're using scientific information. Like this isn't like experimental. This isn't like, gee, I think I'm going to, press this bark into the skin. And I mean, it sounds like this is very, very, very scientifically based therapies.
There is nothing that we administer to our patients that is not fully and completely scientifically supported. For instance, curcumin, there's about 100 publications on the benefit, on the medical journals on the benefit of curcumin. But again, it's a natural element and it's not FDA approved. And unfortunately, the public and the patients, as well as the doctors, have this idea that if it's not FDA approved, it's not good, right? More or less. Well, that's not true. Did you know that bananas are not FDA approved? And yet
I
we
never
all
thought about
know
that.
it's Food and Drug Administration, right? And
Yes.
we all consume bananas and we all know that they're very good,
Mm-hmm.
but they're not FDA approved, right? It's just they didn't go through the process of the FDA.
Yes.
And so many natural things are studied, but they stay at the laboratory or in vitro or in vivo with animals, and they will never go to clinical trials because it's so expensive, and you will never get a patent. So I'm praying that with this new administration that you have in America, that Bobby Kennedy will come up with an incredible idea on how to incentivize people that want to study alternatives and that they would get their money back. I think that would change everything. And that there's so
Yeah.
many natural things that are extremely effective, very profoundly scientifically proven, but
Mhm.
that are not going to go through the FDA process.
Conversations with a Chiropractor is brought to you in part by Lemon Grove Oil.
Hey there, I'm here to talk about Lemon Grove CBD oil. I absolutely love this product. It is nano-powered CBD, which is great for inflammation and pain, anything that you're feeling discomfort. And the wonderful thing is that there is no THC. I'm a chiropractor and a nurse, and I cannot have any THC in my system because of my license. So the very cool thing is that this nano-powered CBD has zero THC. Just CBD, wonderful for pain and inflammation. And I love the lemony scent.
To learn more about Lemon Grove Oil and to find out where to purchase, follow the link in the description of this episode.
So, Dr. Contreras, let's backtrack a little bit. Cancer rates are increasing astonishingly, and more young people are getting cancer. What would you have to say about that?
Well, I have noticed that in the last 5 years, where we have younger patients with more aggressive tumors. For instance, colon cancer takes 8-9 years to develop, and we have patients in their 20s where we never saw that before. In fact, right now, of all of our patients, half of them are less than 40 years old.
Wow.
And so we have noticed that younger and younger people are developing cancer. And I think that there are many contributing factors to that. But one thing that really comes or pops up is the fact that people have been vaccinated against COVID. And even though nobody has published anything that is the cause, everybody knows that it's a contributing factor.
Yeah.
Also, the unexplained deaths that rose tremendously. The only difference is the COVID vaccine, which is not a vaccine, by the way. It's a drug that was called a vaccine for legal purposes so that they could not be sued. And I do believe that those drugs that manipulate the DNA, lastly, they're modified medications, but that they lastly will affect the DNA, are contributing to the fact that we have more aggressive malignancies and that they appear thus in younger people because their proliferation rate is so much higher. Again, there are no studies that prove that it's a cause, but nobody can deny that it's a contributing factor and that there's a relationship.
Absolutely. Can you speak on, and I don't know the answer to this, so if someone has had the COVID vaccine, is it true or false that their genetic makeup is now changed? Would you say that like that mRNA coding has now changed their DNA? And to kind of part two of that question, is there anything that someone can do to quote unquote like do a cleanse or remove the effect of that vaccine if they've had it and put it into their system?
Well, this is a very interesting question. What I can tell you is that our genetic codification or code cannot change. And I don't think that vaccines are going to be able to do that, any type of vaccine. But the cancer is a genetic disease in the sense that it's caused by cell mutations. So the code doesn't change, but a particular cell's DNA can be mutated. And in fact, before COVID, that's what causes cancer. And that's why the toxins and pollution play a major role in the development of cancer. So the vaccine is just another factor that can increase the possibility of mutations that can lead to cancer. So I think that I can categorically tell you that the COVID vaccines are not changing the structure of our DNA, and that suddenly we can convert into some type of monster because all of our cells are going to change. Okay. So it's important
Okay.
to make that difference.
Mm.
Is there a way that if you have been vaccinated, you can detoxify? Well, yes, there are some protocols that will remove the spike protein, which is the major mutation or mutation causing agent, and you can find a number of protocols that you can do at home to reduce the amount of spike protein circulating in your body. And I would, if you had the vaccine, especially if you had a series of vaccines, because most people, they were, forced to have a second vaccination. And there's people that they were so convinced that it was so good that they had 4 or 5 boosters. And so if you had those, I would urge you to look into the internet for these procedures. There, since we didn't do vaccination at the Oasis of Hope, we don't have a protocol, but it's not a complicated protocol. I saw it once a few months ago. And if I knew it, I would tell you
Mhm.
how to do it. But it's not complicated for people to seek the possibility of detoxifying, quote unquote, from the spike protein.
Well, I'm going to make that part of my homework to find someone who's an expert in this because, I think that it is so prevalent. And yeah, these cancer rates and heart attacks and blood clots, and there's so many health conditions that have increased, since.
No question about it. So there is a definite relationship there.
Could you tell me if I asked you, what are some early metabolic warning signs that people might overlook as like precursors to cancer? So you said like it takes 8 to 9 years for someone to develop colon cancer. What would some of the warning signs in those years have been?
There are very, very few that you can notice. By the time you have symptoms is because the cancer is already there. And that's why it's so, in the conventional realm, we are taught that there is no way to prevent cancer. Why? Because it's a silent killer. By the time you have symptoms is because it's already there. So there are no changes metabolically or physically to let you know that something is happening that could lead to cancer.
Hmm.
But their factors are very well known. So there are things that you can do to reduce the risk. And so what are those? They're actually quite simple. There's about 100 published studies that show that people that consume 5 portions of vegetables and fruits a day have 50% less possibility of developing cancer than the ones that don't.
Wow, that's
Okay.
a huge statistic.
And what are 5 portions of fruits and vegetables? A portion is what fits into a cup, a measuring cup when you cook. It's
Hmm.
almost like the cup of coffee. In the old days, because right now people drink, this large,
Ventis,
correct.
grandes.
So 5 portions of fruits and vegetables is not a lot. And the interesting thing about all of the studies is that it's adding that to your diet, meaning that if you continue eating all of the junk, you would still get the benefits. So imagine if on top of that, you get rid of the junk and eat healthy foods, well, you would drop it even more. The other is that if you exercise 4 hours a week, half an hour a day, strenuous exercise. What is strenuous? Brisk walking. If you walk briskly a half an hour a day, what does that mean? Well, window shopping is not enough.
Yes.
But brisk walking a half an hour a day will reduce another 50%.
That's amazing. That's
So those
just
two
so
things
simple.
on their own are going to reduce the risk significantly of you developing cancer, because your question is very profound, and there are no signs at the beginning whatsoever that you can feel or see that, I might develop cancer because I'm losing weight. Now, if you start losing weight without wanting to lose weight, that can be a sign that cancer is already there. Lose your appetite, you know. There are a number of signs, but it's because it's already there. So the most important thing is to reduce the risk. And then the last one that I would talk about is stress. Stress deteriorates your immune system to the nth degree. And when your immune system is not working correctly, you open the doors for those mutations that we were talking about, for our immune system not to get rid of the cells that are mutated, because we all have cancer cells circulating, okay? We all have those mutations, but our immune system was designed to get rid of them. But if the immune system is affected by poor diet, by the fact that we don't exercise, and the fact that we are stressed, well, then those cells can grow and grow until they form a tumor. So, what is the best way to fortify your immune system? Well, it's by being spiritually strong, because our life is all emotionally dependent, right? We respond emotionally to everything, to the weather, to problems. And so stress is very devastating to our immune system. But if you are spiritually strong, then you are going to respond emotionally in a constructive way, right? A problem, you will find better solutions, or you can deal better with a problem when you're emotionally strong. So consuming fruits and vegetables, exercising, and being right with God is the easiest and cheapest way to reduce significantly the possibility of you developing cancer.
I love that simplicity because I feel like sometimes it's so overwhelming, right? Like I just talked to a guest and we were talking about red light therapy and, the infrared saunas and grounding and toxins and pesticides and GMOs. And I think that it's really overwhelming for people. And I
Right?
think sometimes people might, the old saying, throw the baby out with the bathwater. They're like, well, if I can't do everything perfectly, then I'm just not going to do anything. And I might as well drive through McDonald's and I might as well do this and I might as well smoke the cigarette, and I might, because, you feel defeated before you even begin. So I
Yes.
absolutely love these simple things that we can do that you've just given us. Thank you. Thank you for
And
that.
it's important because I remember when I was quite young and I was finding out about all of this toxins and everything and organically grown food. And I would travel. I travel a lot, and I would travel with my Tupperware with my organically grown foods, and I became a nuisance to myself and everybody else. And then I found that there were 8,000 chemicals in the clothes that we wore, for which we were not designed to live in contact with. So I went naked. And then I said, I think I'm overdoing it. And so I hear you. There's so much information there that causes so much stress. And God has, what are the words in English? Wonderfully and fearfully. We are wonderfully and fearfully made. He has given us resources to offend ourselves from all of these pollutants. And yes, the more that you can be away from them, but there are other means to get your immune system in order. People that have their immune system working 100% for them, they never develop cancer. That's why we all know of the little old man that lives in the corner, smoked. He's 95, smoked all his life, only ate hamburgers, never drank water but Coca-Cola, and healthy, right?
Yeah.
Why? Because the immune system is just up to par. Most of us are not born with a perfect immune system, and we have to take care of it. So yes, it's important to be responsible and stay away from toxins. But the more things you want to do, the more stressed you're going to be, and the less your immune system is going to work for you. So simple
Yeah.
things are more important to do.
Conversations with a Chiropractor is brought to you in part by Lemon Grove Oil.
Dr. Stephanie Wautier here. I'm here to talk to you about lemon grove oils. I was so excited when I met Dr. Jerry Del Canton on LinkedIn. He introduced me to this product that he invented. It is a brightly wonderful fragranced lemongrass CBD. No THC, nothing to worry about if you're drug tested. CBD nano-powered technology, creamy, lovely fragrance, so bright like the sun. Lemon Grove CBD. Try it today.
To learn more about Lemon Grove Oil and to find out where to purchase, follow the link in the description of this episode.
I love that. What would you say to our listeners who are thinking about, I'm just going to use breast cancer as an example. You know, there's a lot of word on the street that, you know, mammograms are not healthy because they're perhaps irradiating the breast, you know, and causing trauma. And some people think thermography is better. Do you have an opinion on that? And if you'd rather not say, I understand.
No, obviously. And yes, I have an opinion. I think that this information is very important for everybody to understand. So when you're doing a mammogram, you're not preventing anything first, right? You may be detecting a problem sooner, and which is good, but it is true that radiation increases the possibility of women developing cancer. Fortunately, the new radiology machines that we have available now use a lot less radiation than 10 years ago. So 10 years ago, every time you took a mammogram, you increased the possibility of developing cancer by 1 or 2%. So if you do them twice a year, well, you increase, by a lot after 10 years. And so I do not recommend mammograms for prevention screening. Nowadays, sonography or ultrasound has proven to be extremely effective in detecting tumors without any radiation. And the best one is MRIs, but they're so expensive, right?
Yeah.
So do sonograms, and only if the sonogram is abnormal, then do a diagnostic mammogram. And I think it's important to detect early because the incidence, as you said, is so high. Now, thermography, I did a lot of studying on thermography because I'm against screening mammography. Unfortunately, the information that you obtain is very difficult to interpret. Now, if you have a mammogram and you have 10 radiologists interpret that, 9 are going to come up with the same, at least 9 of them are going to come up with the same interpretation.
Okay.
On a thermography, 10 different opinions are going to come up with 10 experts at looking at them. So unfortunately, to date, the information that you get from a thermography study are not so reliable because I cannot rely on an interpretation that is going to be with so many variations. And that's why I don't use thermography. Once somebody comes up with the method that most people are going to come up with the same information, I think it could be a very, very useful tool. But to date, I haven't found that.
Okay. I'm going to ask another question and just stay on breast cancer while we're here. So please correct me if I'm wrong. But if your body detects a cancer cell and or cancer cells plural, like in the case of breast cancer, would you say that like a calcium shell, which would be detectable by X-ray, is like the body's way of kind of encapsulating it or keeping it safe? And part 2 of that question, would you say that a biopsy, which would be introducing a needle and perhaps pulling those cancer cells from that encapsulated tumor, would increase the risk of metastasis? Or am I completely off base?
No, you're not. There's no question that the tumors in most cases are quote unquote encapsulated. It's not precisely that, but they do have a sheath of protein that keeps them, even though they're growing, and they may shed cells at any rate without you poking them. And it is true that there is a possibility that when you introduce a needle, that you can open that up and open the possibility of spreading. Now, life is about evaluating risk and benefit. And we do many things that are very risky, but we come to the conclusion that the benefit overrides the risk. The number fourth cause of death, I think, in America is car accidents. Very high, especially on teenagers. Yet we drive. Why? Because the benefit overrides the risk, right? Even though there's thousands of deaths, there's millions and millions and millions of miles, right?
Absolutely. Absolutely. Right.
So in order for me to design a therapy for a patient, I need the most information that I can get from the tumor, because not all tumors are the same. Breast cancer is a family of diseases. And so as an oncologist, I can tell you that the risk of not knowing what type of cancer and not providing the correct treatment is higher than the risk of poking that tumor to get information. So the benefit of obtaining information from tumor overrides the risk of the biopsy. And I would like everybody to understand it, because people are so afraid. But then how are we going to design therapies that are effective if we have no information? So yes, for everything that we do in life, there is a risk. But if the benefits are much better, let's go for the benefits. So I hope
That's such
the way that I'm explaining it to you is not that it's not true what you're saying, but it's the other side is also true, and for us as physicians, it's paramount that I have the correct information to be able to treat you. It's like finding out what type of bug is causing your infection, because the treatment against a virus and a bacteria is dramatically different. And so if I don't
absolutely.
know, I'm going to be giving you things that might be, and all therapies can be toxic. So I want to make sure that it's the best possible treatment that I can give you based on a good diagnosis.
So, Dr. Contreras, if someone has a new diagnosis of cancer or someone is in the middle of treatment, like, is there a time that it's appropriate to come to Oasis of Hope? Is there a time that's not appropriate to come to your hospital?
Wow, that's a loaded question. In our statistics, we show that patients with stage 4 breast cancer that have been virtually sent home to die, when they come to the Oasis of Hope, our 5-year survival rate is 3 times better than with conventional therapies. So more or less 16% of women that come to treatment with stage 4 breast cancer are alive after 5 years. In our experience, it's 50%. But when women come to us first, our 5-year survival rate is 75%, 5 times better. So the sooner you come to us, the better the results are going to be. When is a patient not suitable to come to us? We definitely will tell patients. Let's say that a patient is coming to us with pancreatic cancer, but has liver metastases, and the liver is failing. The patient already has liver failure. Our treatment is not good for that person. When there is kidney failure, our treatment is not good for that person. So when a patient contacts us, we are going to take everything into consideration, and we will let them know if we can help or not. So yes, the sooner you come, the better, but there are cases where we cannot help, unfortunately. Now, we have patients that came to us, responded well for a while, and then developed liver insufficiency. We've had patients that no matter what, I want to go to the Oasis, because that's where I feel that I'm loved, that I'm been taken care of, and I just rather spend my last days with you. That sounds a little bit sad, but we feel very honored when a patient makes that decision, because our main thing is to love our patients as we love ourselves. That's one of the philosophical pillars. And so the environment of our hospital is not gloom and doom. And so we actually have a very happy place in spite of the fact that patients have cancer. And so our patients appreciate that environment and they want to come and spend time with us.
Does a patient who comes to you need a referral from any physician, or do patients just connect with you like on your website if they want to come to you?
Yes, we do not need or require a referral. In America, due to law restrictions and safety, legal safetiness, they require that because then they can share the responsibility with somebody else. No, we do not require that, and patients can come to us without a referral. And yes, if you read our page, we offer a free consultation, Zoom or telephone, with anybody that's interested.
Oh, that's wonderful. Now, Doc, you have authored like 15 books. Where could we find your books to purchase if we've, been inspired, if my listeners want to know a little bit more about you or a little bit more about Oasis of Hope? Is that on your website or?
Yes, it's on our website, oasisofhope.com. And in fact, my latest book, The Art and Science of Undermining Cancer, where I provide information of all of the treatments available, conventional and non-conventional, so that people can, make an intelligent decision on how to be treated. I wrote this book in a way that it's simple for lay people to understand the treatments in cancer. I always said that information is the most important thing in order for you to make decisions. But nowadays, there's so much information because of the internet that it's overwhelming and confusing.
Yeah, absolutely.
And that's why I wrote this book to take the confusion away and people to understand. And this book is available for everybody for free in our website. You can download it. And I think it's information that would be very important for people that have cancer. Or if you have a loved one, let them know that it's available. And after reading that, if you want to contact us and for us to discuss your personal cancer journey with us, we will be very happy and honored to give our these patients our opinion and recommendations.
That's amazing. I feel like there's so many more questions that I have, and I mean, you're this oncological expert, but is there anything else that's on your heart that you'd like to share as we talk to our listeners?
Conversations with a Chiropractor is brought to you in part by Lemon Grove Oil.
Dr. Stephanie Wautier here. I'm here to talk to you about lemon grove oils. I was so excited when I met Dr. Jerry Del Canton on LinkedIn. He introduced me to this product that he invented. It is a brightly wonderful fragrance lemongrass CBD. No THC, nothing to worry about if you're drug tested. CBD nano-powered technology, creamy, lovely fragrance, so bright like the sun. Lemon Grove CBD. Try it today.
To learn more about Lemon Grove Oil and to find out where to purchase, follow the link in the description of this episode.
I think the message that I would like to leave for you and your listeners is that cancer is not necessarily a death sentence. And nowadays, people don't even like to say the word cancer. It's like, oh, the C word and stuff like that, because they associate cancer with death. We nowadays have a number of treatments that are very well tolerated by patients. That is, no chemo, no radiation, many natural things that are extremely effective that can help you manage cancer, that can help you live with cancer, and can help you get rid of cancer. So we have patients that were told you're die in 6 months. If you take chemotherapy, maybe a year. And 20 years later, they're still alive. And if we take x-rays, there's tumors there. But now they can care less, because they're enjoying life. And we also have many patients where the tumor goes completely away. But do not let the devil steal your joy. Life is precious. Every day is a gift. And again, there are many possibilities nowadays for patients to be treated effectively against their malignancies. And so look at cancer as another problem that God has provided us as doctors and you as patients resources to combat these malignancies effectively.
That is so profound, because I do think that so many people might hear the word cancer and immediately think, well, I'm going to die. How much longer do I have to live? And or they think the chemo is going to kill me, the radiation is going to kill me. Like I just feel like we've had just this narrative around cancer that's been so absolutely stealing our joy, absolutely doom and gloom. And I mean, the title says it all, Oasis of Hope, for you to be able to give patients hope and say, yeah, like maybe you're going to live 5 more years, or maybe you're going to live 10 more years. Or, there's a funny thing that says, like, if you have 30 days to complete a task, you'll get it done in 30 days. If you have 1 day, you'll do it in 1 day. So,
Right.
I mean, there has to be something psychological about someone giving a physician giving a patient, you have 3 months to live, or it's going to be about 2 months. I mean, there has to be something that happens psychologically that they just suspect, okay, well then, here's my 2 months and I guess it's going to be my time. And
Yeah, you say, oh my God, it's 2 months. I should drop dead right now. I can't let my doctor down. Can people die? Our mind is extremely powerful, and it can be extremely powerful for the contrary, to live. That's why if you look at all of the studies, double-blind studies in cancer, most of the studies show that the placebo is better than the drugs. And that's just the power of the mind. So let's exploit the power of the mind. And that's why hope is so important.
yes, absolutely. Well, like I said at the beginning, I'm just so honored that you took time out of your extremely busy schedule to have a conversation with me. And I know that our listeners are going to be truly inspired. And I'm so excited that they now have something tangible. They have some easy steps for cancer prevention. They have your website, oasisofhope.com. They also have a free book that you're giving them on your website. And, you truly are a like living hope and bringing that healing power to this world. So you have been a good and faithful servant. And I know the Lord will say that
Amen.
someday. So
Amen
thank
to
you
that.
so much for being on my podcast, Doc. I've just so appreciated it.
Thank you very much. God bless you. And God bless all of your listeners.
Thank you. Bye-bye.
Thank you so much for listening. If you've enjoyed this podcast, would you please rate it, review it, like, or subscribe? You can find me on social media at wautierwellness.com, Dr. Stephanie Wautier on Instagram, or Wautier Wellness Chiropractic and Massage on Facebook. And I'm so curious where your next conversation will take you.
I'm Serena Williams, and I'm healthier on Ro. I've lost 34 pounds in a year with GLP-1s, diet, and exercise. On Ro, you can access GLP-1 options, including the first FDA-approved GLP-1 pill for weight loss. Go to ro.co/journey to see if you qualify. 14 to 20% average weight loss in 1 year in non-diabetics with obesity or overweight with a weight-related medical condition versus 2.2% to 3.1% in placebo arm. RX only. To stay informed about serious side effects, go to ro.co/safety.
Ever wonder why scam calls feel so specific? Why they somehow already know your name, your city, or even your address? It's usually because of data brokers. These companies collect your personal information from across the internet and sell it online, usually without you even realizing it. Things like your phone number, home address, family members, and even places you've lived. And once your information is out there, it spreads fast. That's where Aura comes in. Aura automatically finds your personal information on data broker sites and submits removal requests for you. Then Aura keeps monitoring to help make sure your information stays gone. You can even see where your data was found and removed. And Aura goes beyond data removal. You also get a VPN, antivirus, password manager, spam call protection, dark web monitoring, and up to $5 million in identity theft insurance. Right now, you can try Aura free at aura.com/hidden. That's aura.com/hidden.